When surgeons talk about other surgeons, sometimes they make the same comments we have been hearing through generations. Like, for example, X surgeon got safe pair of hands, or Y surgeon was born with good hands. These comments are taken as the highest praise, the ultimate endorsement for a surgeon. But there is an issue. It's a myth. Hands are not safe. Hands don't make surgical decisions. Hands don't anticipate complication. Hands don't get patients safely through difficult anatomy. Good surgical skills don't develop in hands at all. They develop in the head. And if we want to train safer, smarter surgeons, we need to stop focusing on hands and start investing in the surgeons' heads. That's what this video is about. Debunking the myth of safe hands and showing how real surgical skill lives in the brain. Hi, I'm Dr. Uttam Shiralkar, a surgeon and psychiatrist based in the UK. And you're watching a channel dedicated to achieving surgical excellence. Let's start with the history. Why do we keep telling ourselves that a surgeon's hands define their skills? Back in 19th century, surgery was all about speed. This was before modern anesthesia and asepsis. Patients were literally strapped down, awake or barely sedated. The faster the surgeon, the more likely the patient survived the operation and avoided infection. That's why surgeons like Robert Liston became legends. He could amputate a leg in under 3 minutes. Back then, a surgeon's hands really did seem to matter most. Fast forward 200 years. Now we have anesthesia, critical care, infection control, imaging, minimally invasive techniques. Yet, the idea of the gifted hands still dominates surgical culture. It shows up in comments we all hear. She is a natural. He has got good hands. The trainee's not ready. Their hands aren't safe yet. But here is the truth. Surgery today is not about hand speed or natural dexterity. It is about thinking. How good your surgical software is. Good outcomes don't come from instincts in the fingers. They come from operating system developed over the years. Let's pull back the curtain on what really happens in an operation. Because when you break it down, even so-called hand skill actually begins as a head skill. Take a common case like removal of gallbladder, the laparoscopic cholecystectomy. On the surface, outsiders see simple physical actions, grasping, retracting, cutting. But underneath those moments is a flow of thoughts. First, mental mapping. The surgeon builds 3D picture in their head of ducts, arteries, and variations. Because patients don't come with labels. Second, strategic planning. Before cutting, the surgeon has already run through the ideal sequence of steps, as well as alternative routes if things don't look right. Third, risk anticipation. They're asking themselves a lot of what ifs. What if this is an aberrant duct? What if the artery bleeds? And so on. Fourth, execution and adaptation. Every move is evaluated in real time. Am I too close to the bile duct? Is the traction too much? Is the exposure too little? From outside, it looks like a hand skill. But if we could hook the surgeon's brain up to a monitor, it would look more like a high-speed game of chess. Let me give you a story. Imagine two surgeons faced with the same gallbladder case. The first surgeon has incredible skills, sharp hands, no tremors. But when they encounter unexpected scarring and can't identify the anatomy clearly, they push through, relying on speed and instinct. The second surgeon, their hands are average, knots might take longer, movements are less elegant. But when they hit that same scenario, they pause, they think, they call for an on-table cholangiogram. They move methodically, exposing and confirming the ductal anatomy before proceeding. Now, here is the question: who has the safer pair of hands? The answer is obvious: the one who thought their way through the problem. The hands didn't make the difference, the mind did. So, let's talk about development. How do you go from shaky trainee to a skilled operator? At first, yes, it feels clumsy. Early on, every suture, every knot is awkward. But what's really happening is your brain is overloaded. Beginners are trying to remember anatomy, recall steps, manipulate tools, and deal with pressure all at once. It's chaos inside their heads. With training, the brain starts to offload the simpler motor tasks to muscle memory, freeing up bandwidth for higher level thinking. That's when you progress from novice, focused on rules and rigid steps, to competent, starting to think in sequence and workflows, to proficient, anticipating and adjusting, and finally to expert, where decisions look intuitive because the brain has built a vast internal library of patterns. So, when we praise experts for beautiful hand, what we are really watching is the mastery of the brain that has trained itself to see, decide, and direct. Here is where the myth fully unravels: complications. Imagine an unexpected arterial bleed. At that moment, what determines the outcome? Not hand steadiness, it's early recognition, clear communication with assistant nurses, choosing the right control strategy, and knowing when to call for help. A surgeon who panics, no matter how gifted their hands, can make things worse. A surgeon with average dexterity but calm judgment will save the patient. Complications expose the truth. Safe surgery is a cognitive discipline, thinking. Hands are tools, brains are safety system. So, how do we apply this in surgical training? Here is a shift we need in surgical training: mental rehearsals. Trainees imagining every step before operating. Studies have shown that it improves accuracy and reduces errors. Second, simulation scenario. Not just tying knots on a bench, but practicing crisis management, judgment calls, and bailout strategies. But here is the hardest part: culture. Language matters. Every time we praise good hands, we reinforce the wrong idea. We need to shift our praise to good judgment, excellent anticipation, smart decisions, and so on. The next cultural change needed is from mentors. Mentors or trainers need to make their thinking visible. Senior surgeons often operate silently at an expert intuitive level, but trainees need to hear their mental algorithm out loud. They need to see the mind behind the moves. And trainees, they need reassurance. You don't have to be born with gifted hands. Steadiness can be trained. Dexterity improves with repetition. But the real challenge and the real focus should be training your mind. So let's debunk this once and for all. The phrase, a safe pair of hands, may sound comforting, but it is misleading. Hands don't keep patients safe, brains do. Good surgical skills are born, trained, and refined in the head. They are only seen in the hands. And if we want to educate the next generation of surgeons safer, smarter, and better, we need to stop celebrating gifted fingers and start nurturing thoughtful minds. To trainees, don't doubt yourself just because your hands feel clumsy at first. Focus on building your cognitive skills, your operating system software, your preparation, anticipation, and judgment. your hands will follow. And to trainers, let's change our language, change our methods, and above all, make our thinking visible. Because safe surgery is not in the surgeon's hands, it is in their heads.